In Lesson 3, we will learn to compile the essential information on the adverse drug reaction. Not all reports come with an extensive narrative, an extensive description of what has actually happened to our patients. Sometimes we just have a coded term describing the suspected ADR and the name of a drug. We have seen previously that when we analyze a signal, we start with one, maybe two, maybe more reports coming in that raise our suspicion. We assess them for causality, as we have learned in Module 2. We build up a case series and we assess that also looking specifically for consistency and patterns, as we have learned in Module 3. Now, in order to be able to build up a real consistent case series made up of comparable reports, we need to know exactly what ADR we are looking at. What is this? Sometimes it is just a symptom being reported. So, for example, anemia. Let's assume that we receive a report on a patient with anemia under a certain drug treatment. Well, anemia can have many causes. Anemia can be caused by bleeding or by bone marrow suppression. It can be caused by hemolysis or infection. And malnutrition also can cause anemia due to lack of iron or vitamin deficiency. And there might be many other reasons. So we have to work out exactly what kind of anemia are we looking at when we want to try to build up a case series. If we can reasonably assume that in this case anemia was caused by bleeding, we will build up a case series looking for other cases that do not only report anemia, or maybe do not report anemia at all, but report bleeding in the wider term. It is very important to recognize the pathogenesis of an adverse drug reaction, as many drugs cause adverse effects through specific mechanisms. If you want to go back to our example on anemia, if a report lists only low hemoglobin or anemia, and let's say, for example, C-reactive protein increased, the cause of the anemia can be multifold. It can be an infection, it can be whatever else. It could be bleeding as well. But if in addition to low hemoglobin and elevated C-reactive protein, we also have hematemesis, the vomiting of blood, then we might reasonably assume that in this case, anemia was caused by gastrointestinal bleeding, and we will compile our case series with other reports with bleeding as the cause of anemia. Differential diagnosis in clinical medicine is very, very important, and it is also at the core of case assessment. Differential diagnosis is the weighing of the probability that symptoms that we observe in a patient are caused by one condition against another one. As in clinical medicine, an exact description of what has actually happened to a patient, the chronology, the course, and the outcome is very important. The same applies for causality assessment and our case assessment in pharmacovigilance.